Everyone is advertising skin treatments with promises of, looking more youthful or making your scars go away. But unfortunately, many of these can actually make your skin worse. I have patients that have come to me after they have been fooled into doing one of these, and then I have to help them recover their skin. Hi, my name is Dr. Morgana Colombo. I'm a board-certified dermatologist practicing in Northern Virginia and the founder of Vida Derma, a science-backed skincare line to help women as they age. As a dermatologist, I see patients every week who come in with skin damage from treatments they wish they had never tried. Some of these are professional procedures that have been sadly done by the wrong hands. Others are products people use at home without understanding the risks. Today, I want to walk you through the skin treatments that patients most commonly regret, so you can protect yourself before it's too late. So let's start with one of the biggest ones. This is aggressive laser treatments done by unqualified providers. Laser resurfacing with CO2 erbium can do incredible things for the skin when it's done correctly. It can reduce wrinkles, fade scars, and even out skin tone. But here's the problem, guys. When lasers are used with the wrong settings, on the wrong skin type, or by someone that does not have the proper training, the results can be horrendous, devastating. We're talking burns, permanent scarring, and lasting changes in skin color, either dark patches called hyperpigmentation or light patches even called hypopigmentation. There is actually a review of the FDA adverse events that found that burns accounted for over 60% of reported laser complications, followed by scarring and pigmentation changes. Darker skin types are especially vulnerable to these problems. The takeaway here is simple. Laser treatments are powerful tools that need to be done in the right hands. Go to a real doctor who has a degree to do these skin rejuvenation procedures, not someone who took a course over the weekend. Next, let's talk about at-home microneedling, especially when it's combined with unapproved products. Microneedling, which is using tiny needles to create micro-injuries in the skin, can stimulate collagen and improve texture when done properly. But when people buy dermal rollers online and combine them with random syrups or vitamin C products, they're essentially injecting these substances into their skin. There are documented cases of patients developing severe facial granulomas, which are hard, disfiguring lumps under the skin after microneedling with products that were never meant to go beneath the surface of the skin. Some of these reactions took months of treatment to resolve. If you're going to do microneedling, it should be performed by a trained professional using products that are actually safe for intradermal use. There are some limited at-home microneedling products that are safe to use, but always check the system with your doctor first. Now, here is one that really surprises a lot of people. Many patients actually regret getting deep chemical peels without proper evaluation. Deep peels are not like superficial peels. Superficial peels like a glycolic acid peel, those are generally safe and recover quickly. But medium and deep peels, especially those using TCA or phenol, carry real risks. These could mean prolonged redness, infection, and scarring. The risk goes up significantly when these peels are done at non-medical spas or by practitioners who don't assess your skin type beforehand. If you have darker skin, a deep peel can be very bad, can trigger severe post-inflammatory hyperpigmentation that can be permanent or last months. Let's move on to something I feel strongly about: skin lightening and skin bleaching products. This is actually a global issue. Many over-the-counter and online skin lightening creams contain dangerous ingredients like mercury, high concentration hydroquinone, and potent steroids, often without listing them on the label. Mercury can cause kidney damage, including nephrotic syndrome, which is a terrible disease. You don't want that. Prolonged hydroquinone use can cause a condition called exogenous ochronosis, where the skin actually becomes darker and develops a blue-black discoloration, the exact opposite of what people were trying to achieve. Topical steroids used long-term can thin the skin, cause stretch marks, and even suppress your body's natural hormone production. Also can cause permanent white discoloration. These products are banned in many countries, but they're still widely available online. If you're concerned about uneven skin tone, please talk to a dermatologist about safe, evidence-based options. Another treatment people often regret is permanent makeup and cosmetic tattoos. Permanent eyeliner, lip color, and eyebrow tattoos can, be very convenient and seem great, but the pigments used have the potential to trigger allergic reactions, and what is crazy is that sometimes it can happen years after the procedure. Red pigments are especially problematic and have been linked to chronic swelling, granulomas, and even a condition called pseudolymphoma, where the immune system reacts so strongly that it mimics a type of skin cancer under the microscope. Removing these pigments with laser is possible, but it's painful, expensive, and not always successful. Finally, let's talk about dermal fillers from unqualified injectors. Fillers like hyaluronic acid are generally safe when injected properly by experienced providers, but when injected incorrectly, fillers can block blood vessels, a complication called vascular occlusion. These can lead to tissue death, permanent scarring, and in the most serious cases, even blindness. Litigation data shows that filler complications are among the most common reasons for lawsuits in cosmetic dermatology. And in many cases, the person doing the filler was not a board-certified physician. So what's the bottom line here? Most of these treatments aren't necessarily bad. The regret usually comes from three things. Number one, choosing an unqualified provider. Two, choosing unregulated products, and skipping the conversation with a doctor who knows your skin. Before you try any skin treatments, ask your dermatologist if it is safe for your skin. Your skin is the largest organ in your body. Treat it with the same care you'd give any other part of your health. If you found this helpful, remember to hit like and subscribe. If you have questions about your skin, leave them in the comments below, and I will do my best to make a future video on it. See you in the next one. Thanks for watching.